We have a passion for our people, for African Americans, African American men, women, and children. And there is a great need for ethnic sensitivity, for those who understand that there are differences in the health of African Americans. We make up 12% of the population, but we represent 25% of the deaths. If we don't focus on our people, we are going to continue to be a statistic that is not good. So here we focus on our people, and we intend to have the outcomes change and to improve the health and well-being of those who really need it and are underserved, those who are uninsured, underinsured. That's really our major goal.
We have many, many, many men and women who come into the Oakland community, particularly this West Oakland community, and have had no support or guidance or love to help them make a transition from being longtime inmates to being functioning citizens in our community. And primary among those right now are an anger management program which is offered here. I think that we desperately need to improve the opportunity for men and women who are coming out of prisons and coming back into our community.
The advantage of using a portal in disadvantaged communities is really that there's a place that people can go to, a doorway that they can enter in order to receive some of the services and care that they need. Oftentimes, people don't know where to turn in terms of getting, social support services or healthcare services. So the portal concept is really going through a door in order to see what other options are on the other side. It's a place where people can find some assistance in terms of knowing what direction to turn in order to get whatever social or healthcare support services that they need. So the portal within the community means that it's not across town. It's right there. It may be in their backyard or just a couple blocks up. So it's easier to get access to, easier to find a place to go ask the questions, and a place that has a lot of information and a lot of services that they very well may need.
Healthy Oakland is a beacon light in the community, a community that people have said is down in the mud and degradation of drugs, of crime, poor education and abuse, anger. Healthy Oakland stands as a lotus that grows from the mud. It stands for hope, and the fact that Reverend Langford and Arnold Perkins and Dr. Watson and Bishop Reams have given so much to bring this clinic, this resource to our community, Oakland is the better for it.
What appeals to me most about healthy communities is the commitment to the community. And I know that sounds simple, but it's the fact that they really do put their heart into the work, and they have a commitment to serving people in a very respectful way that values and validates the experience that folks have had out here on the streets. It's not easy. And Healthy Communities has positioned itself to serve those clients that are the least likely to be served by any other clinic, and those that, are the hardest to serve. I mean, they've made preventative health care and taking care of self and family a real priority, and they express that in the way that the staff carries itself, and the way that the board responds, and the way that the director provides leadership. So I think there's just a very holistic approach to being here for the community and having that commitment to improving individual lives as well as the community as a whole here, particularly in West Oakland, but I think Alameda County and beyond is the future goal.
You can come in here, it's not just like we're giving medical advice, we give good advice on life, living, the streets. All the staff here are equipped in certain areas, so it's good. We don't have to send you out too far. I can just walk in this room and get this person for this thing, or I can walk next door and get John or somebody for something else. It's not like I have to send you to this long list and we lose patients. We don't, because it's all within this circle. We do have a good atmosphere because everybody comes from a different background, and they're not afraid to share it with the patients.
I would say that look at what's being done, look at the growth, and look at the trajectory. This is a new clinic. I've worked with a lot of different clinics. Some of them have been around for 30, 40 years. This is a new clinic as a baby in the grand scheme of things. But watch it as a rising star, because it has been here in the community, understands the needs of the community, understands and doesn't just see everybody as a patient or a Medi-Cal visitor. This is something that Healthy Oakland has taken on, and that is what we're doing. So it will continue to grow, will continue to expand, and I think those that care about safety on the streets, that care about the health of the community, that care about basically having a community that's suitable for our children to grow up in, where they're not constantly being traumatized, and where we are cognizant of the things that they're being exposed to and how we can make the community healthier. Anyone who is concerned about these things, I think, needs to keep an eye on Healthy Oakland and watch as they become one of the few that's really out here trying to provide a much needed service.